Hey guys, welcome to Podiatry Practice Mastery. Don here. I had a question from one of the other podiatrists. He was asking me how it was going with these videos, what my patients thought of the videos. And I've told you guys in the past what's my impression of it, but what has been the impression of my patients. So I think I've used these videos about 20 times in my practice. Basically, I have an Android. We just had an old tablet thing that was sitting around, and I've transitioned. I don't upload the actual videos there. I just put them on my website, and it's drpelto.com/presentations. And then when someone comes in, I start the interaction, look at their x-rays, make the diagnosis, and have them watch the video. I've had patients, they've enjoyed it. They haven't said anything. I guess sometimes you don't know, but the nonverbal understanding I have from them is that they've enjoyed it. They found it beneficial. They found it detailed. And what I usually do is, as I'm sitting there, I'll kind of chime in as I hear my voice talking. Maybe I'm talking about insertional Achilles tendonitis and then non-insertional. I have them both in the same video. I think eventually it'd be nice to have a video for each one, so you could specifically have the video to what the patient has. But I'll say, hey, you don't have this one with the spur. You have a non-insertional Achilles tendonitis, and I'll chime in to saying, you don't have a flat foot or something else. So I'm kind of doing it interaction, but during that time, my impression is I can get my stuff done, but from their viewpoint, they've enjoyed it. I think I've had no one's really not watched it. No one's really said they didn't want to watch it. Most people have said it's been good. It's a pretty good quality video, I think, anyway. I try to keep it under 10 minutes because I don't think people want to watch things more than 10 minutes, and I think it's a better outcome than when I used to send it to them. So what I used to do is I used to actually have the slides. I do have the Google Slides up, so occasionally I'll still go through the whole presentation, but I just feel like I'm rushed a lot of times, and so this is a way of not having to rush as I go through that presentation. And then a lot of times I can go out and see another patient and then come back in. What I find is that afterwards I'll just pull up my checklist and then I'll kind of go over, this is what we're going to do, and then I'll send them a copy afterwards as well. I haven't had long-term feedback based on it, but for the most part, patients seem to like it. And there's certain things that I was just kind of skipping, for example, like my one on my diabetes. So when I do a diabetic exam, my comprehensive diabetic foot exam, I'll give them the diabetes one to listen to. So it'll just remind them of the major elements of diabetes and how it can cause ulcers and things like that. And then they just open up the door when they're done. So it's worked out well for me. I'm trying to make one a month. And this idea, once again, wasn't mine. This was Neil Baum's. It was his idea. He had these for his urological procedures, and I found you can do it. Sometimes it takes me a little bit longer than I think his were like 5 minutes. Mine tend to be about 10 minutes because I try to be thorough. And so my impression is it just reduces the amount of strain on me, because what used to happen is I was doing this 10-minute presentation and I'm trying to document my x-ray results, document all these other things, and it didn't go well. So this is the next rendition. So I'd like to know what your thoughts are, if you guys wanted to try it, or if you have tried it, or if you'd be willing to try it. I want to tell you, this person that asked me, I told him, I was really uncomfortable. I wasn't sure what the patients would say. I thought they would hate it. I thought they would criticize me. But I haven't got any of that. I think it was more in my own head. I think what we put as expectations to patients is what they perceive. And what I found is I can give a much better presentation when I'm kind of calm and I record the thing and I can go over everything in detail, versus if you have like the 2 minutes with a patient with plantar fasciitis, you give them the 2-minute version. So I think it's a much better patient experience. Okay? Once again, hope you guys join Podiatry Practice Mastery. Let me know what your thoughts are. Love to hear back from you. Okay, bye.